Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, I'm going to be addressing a topic which came about, at least was being discussed on a dental assistant group page on Facebook. And it regarded cell phone usage while at work. So I know that there are a lot of different practices and they all have different policies and procedures, and they even have employee handbooks, things along those lines, which spell out what you can and cannot do at work and those sorts of things. So it all depends on your practice. I can't speak for all practices. I don't have a specific cell phone policy necessarily. Our practice is very busy, so there isn't much downtime for folks to be playing around on their phones. So that said, I mean, does it happen? Yes. Do I see it? Yes. Do I personally try to curtail my own usage when I'm at work? Yes, I do. It's been a busy past month and a half or so. So I've had a lot of things going on that have been related to work, but unfortunately have kept me on my cell phone at times more than I would like. And so I am actually consciously trying to keep off of my phone while I'm here at work, and of course, in between patients. Even though a lot of matters need to be addressed. So I'm trying to do my best to set an example of not really touching the phone, or at least staying off of it as much as humanly possible. And I think that my team does a great job of staying off of the phones, while they're at work, because typically they're busy moving. So that said, I'm not, unless I see something going crazy, I'm not going to address it, and I've never really seen that. But I can't speak for other owners. I can't speak for other practice managers or office managers. They behave as they want. They will enforce as they want. I personally feel that if there's absolutely nothing for somebody to do, everything is taken care of, the flow is moving smoothly, maybe there was a cancellation and so there's a kind of a chunk of time where there's nothing going on and all the other ancillary duties are already handled. Okay, so take a look, maybe catch up on some news or something for 5 minutes or so, and that's cool. But I'm not going to say just look at the phone every single time you have 2 seconds to spare. That is a little bit of overkill. So I hope you understand that. You can do it, but just don't go crazy. I think that's pretty fair. So that said, hopefully it makes sense. And again, I can only speak for what I do and what we have going on here. I can't really speak to what other people do as far as their own practices are concerned. But if they're not letting you touch your phone and you have maybe some important things going on at home, like very ill relatives, or you need to pay very, very close attention, you're waiting for a certain phone call that's critical to something that's going on in your life, I would hope that your practices understand that and are willing to be able to maybe be a little bit flexible and help you out in that regard. So that's what I can say. Hopefully they do that. So in any event, I appreciate you all joining me. Thank you so much for joining me, and I hope you're all staying well and healthy.